So we're going to talk about MEN today, which is multiple endocrine neoplasia syndromes. There's the number 1 and the number 2. One of the fascinating things about the number 1 is they often have had a Whipple procedure. And the number 2 is 2A and 2B, and 2A is sometimes called the Sipple. So we've got a Whipple and a Sipple, and then we got this extra one, the 2B. The reason they've had the Whipple in the MEN1 is the characteristic feature is a pancreatic endocrine neoplasia, and that can be a gastrinoma or insulinoma, and it can produce endocrine manifestations if it's secreting the gastrin. That's the Zollinger-Ellison syndrome. You might remember that from medical school, which could cause diarrhea. And so the Whipple goes with MEN number 1. The other 2 P's, and there's 3 of them, in the MEN number 1 is pituitary adenoma and parathyroid hormone. So the 3 P's of MEN1, pituitary adenoma, the parathyroid, and the pancreatic. And the way this comes to us obviously is by temporal hemianopsia or vision loss. This one can come to us as hypercalcemia, including band keratopathy. And this one can come to us because the diarrhea can lead to vitamin deficiencies, B12 and folate producing a central scotoma that is painless and progressive, thiamine deficiency producing Wernicke, vitamin A deficiency causing nyctalopia. So the vitamin deficiency things are occurring because patients with the gastrin secretion have diarrhea. In the MEN2A and B, the things that are linking those two together are medullary carcinoma of the thyroid. And since they almost always have that, they've usually had a thyroidectomy. And so that comes to us in ophthalmology as a Horner syndrome, post-surgical from the thyroidectomy, and pheochromocytoma. That comes to us as hypertension, and what we'd be looking for is hypertensive retinopathy. Either grade 1, arterial narrowing, grade 2, AV necking, grade 3, hemorrhages, exudates, cotton wool spots, grade 4, optic disc edema. So hypertension is how the pheo comes to us. And in the patients who have the MEN2B, they have enlarged corneal nerves, and they can have big nerves in other places, big nerves in the cornea, but multiple neuromas, including conjunctival and other mucosal neuromas in their mouth and their lips. And they have a marfanoid body habitus. So these 2A and 2B do not have the pituitary adenoma and do not have the pancreatic lesions. So when we're dealing with MEN1, they've had a Whipple, pituitary, parathyroid, and pancreas. 2A, the Sipple, medullary carcinoma of the thyroid, Horner syndrome, pheochromocytoma. Sipple, and B has no name. Multiple neuromas, big nerves, mucosal neuromas, marfanoid body habitus, medullary carcinoma, and pheochromocytoma. So you should know how these MEN2 things come to us, and the MEN1, pituitary, and pancreas.